Hi, my name is Dr. David Lee, physical therapist, and we're going to talk about standing posture. Okay, so we're talking about standing posture. In the clinic, a lot of my patients complain about low back pain, hip pain, upper back pain, neck pain, shoulder pain from standing in one position. And a lot of times that's because the posture is not correct. So we want to make sure that you're in correct alignment, and then we want to make sure that you're using the muscles to support you in place. If you're not using the muscles, then you're using your joints, tendons, and ligaments, and what happens is that those tend to break down and then you start to experience pain. So let's start from the bottom up. We want to make sure that everything is in the right position. So if we look at our feet, we want to make sure that the weight is in the middle of our foot. So if I slide forward, I'm going to be in the ball of my foot, so you don't want to be there. And if I slide backwards, then I'm going to be in my heels, okay? So we want to be somewhere right in that middle. So a lot of times, if you're feeling the weight kind of towards the balls of your foot, and then you can wiggle your toes, that means you're in the right position, okay? So that's foot position. Next, we want to make sure that our knees aren't bent. So you want to make sure that the knees are straight. So think about really using these quad muscles here and tighten those guys, and that'll help to keep our knees straight. From the hip, we want to make sure that our hips are underneath of us, okay? So we don't want to let the butt stick out like that, okay? We want to get the butt underneath of us, keep the hips underneath of you, so now everything is going down towards the floor. All right, now low back position. With the low back, we don't want to excessively arch the back, and we don't want to round the back this way, okay? So we want to make sure that we're right there in the middle. Also, if we get our hips in the position, that actually helps with the low back position. Now, from up top, we want to make sure that the shoulders are actually opened up. So think about opening up your chest, lifting your chest up. Don't do it excessively because then the low back starts to arch. So you don't want to do this. You want to make sure that you're just doing this and moving from the upper back, okay? So not too much here, just a little bit, enough where you can actually feel the shoulder blades and the upper back muscles starting to work. And then last is our head position. So you want to make sure that your head is not too far forward, because that also makes our upper back round. So think about keeping the head back. Think about keeping the chin down. So you don't want to be here because that kind of sends everything forward that way. So think about keeping that chin down. Again, think about keeping the chest up. Think about keeping the stomach tight with the low back flat and not arched or over rounded. And then hips through, legs tight. So you should be feeling a lot of different muscles working. And what happens is that starts to support us, and then you don't feel pain in all those different joints and tendons and ligaments, okay? So just keep all those things in mind. I know there's a lot of things to remember, but we want to make sure that we're trying to stand like this as often as possible. And you also want to make sure that you're not standing on one leg more than the other. So I always tell people, if you squeeze your butt as hard as you can and you keep everything engaged, it's really hard for you to actually stand onto one leg. So keep engaged as you stand, let the muscles do the work, and don't put pressure on those joints. They have to last you a lot of years. I hope those tips helped with standing posture. If you guys continue to have pain that persists, please consult your medical professional.